The nurse should withhold digoxin if the apical pulse is 90 beats per minute, 70 beats per minute, 60 beats per minute, 85 beats per minute. Correct answer is option C, 60 beats per minute. Which color wristband typically indicates a fall risk? Red, yellow, green, blue. Correct answer is option B, yellow. A pulse oximetry reading of 86% indicates normal oxygenation, mild hypoxia, severe hypoxia. The probe needs adjustment. Correct answer is option C, severe hypoxia. Before feeding a stroke patient, the nurse must first ask what they want to eat, give laxatives, provide fluids, check gag reflex. Correct answer is option D, check gag reflex. The Braden scale is used to assess risk for pressure ulcers, infection, dehydration, falls. Correct answer is option A, pressure ulcers. What is the best position for administering a rectal suppository? Supine, semifowlers, left lateral, prone. Correct answer is option C, left lateral. Which is a sign of post-operative hemorrhage? Hypertension and warm skin, bradycardia and high BP, tachycardia and low BP, stable vitals. Correct answer is option C, tachycardia and low BP. A patient is drowsy and has low oxygen saturation in the post anesthesia care unit. What should the nurse do first? Document and observe, encourage deep breathing, administer a sedative, none of these. Correct answer is option B, encourage deep breathing. A common cause of constipation in hospitalized patients is high fiber intake, increased mobility, laxative overuse, avoid medications. Correct answer is option D, avoid medications. An IV site should be checked for complications once a day, every 12 hours, every hour, once per shift. Correct answer is option C, every hour. Informed consent must be obtained by the nurse, physician or provider, hospital administrator, social worker. Correct answer is option B, physician or provider. Which nutrient is most essential for wound healing? Proteins, fats, carbohydrates, vitamins. Correct answer is option A, proteins. Pain that continues beyond normal healing time is called acute pain, chronic pain, neuropathic pain, phantom pain. Correct answer is option B, chronic pain. Using silence in communication helps to create awkwardness, encourage reflection, avoid difficult topics, speed up the interview. Correct answer is option B, encourage reflection. Which position is best for rectal medication administration? Supine, prone, Fowler's Sims position. Correct answer is option D, Sims position. What is the first nursing action upon receiving a post-operative patient? Check pain level, check surgical site, assess airway and breathing, take blood pressure. Correct answer is option C, assess airway and breathing. A patient with fluid overload will most likely show edema and crackles in lungs, hypotension, dry tongue and eyes, flat neck veins. Correct answer is option A, edema and crackles in lungs. Which position promotes optimal breathing in a dyspneic patient? Supine, high Fowler's, Trendelenburg, Frown. Correct answer is option B, high Fowler's. When should pain be assessed? Once per day, only when patient asks, before and after interventions, only before discharge. Correct answer is option C, before and after interventions. Which is the best action after a medication error? Ignore it if the patient is fine, report it immediately, keep it confidential, tell the patient only. Correct answer is option B, report it immediately. Which term means a drug has a harmful effect on the body? Synergistic effect, teratogenic effect, therapeutic effect, toxic effect. Correct answer is option D, toxic effect. Which of the following is considered a sterile body area? Skin, mouth, lungs, intestines. Correct answer is option C, lungs. Which factor increases the risk for constipation? High fiber diet, immobility, daily exercise, high fluid intake. Correct answer is option B, immobility. What is the most serious risk with IV therapy? Air embolism, phlebitis, faint at sight, infiltration. Correct answer is option A, air embolism. To reduce the risk of post-operative pneumonia, the nurse encourages bed rest, nasogastric suction, incentive spirometry, intravenous antibiotics. Correct answer is option C, incentive spirometry. A patient with low albumin is likely suffering from dehydration, overhydration, fever, malnutrition. Correct answer is option D, malnutrition. Which electrolyte is most closely related to muscle contraction? Chloride, sodium, potassium, bicarbonate. Correct answer is option C, potassium. Which color of urine is normal? Pale yellow, red, cloudy white, dark brown. Correct answer is option A, pale yellow. The nurse suspects a UTI. Which finding supports this? Clear urine, burning sensation during urination, no urine output, urine pH 7.0. Correct answer is option B, burning sensation during urination. A tympanic thermometer measures rectal temperature, axillary temperature, oral temperature, ear temperature. Correct answer is option D, ear temperature. Before surgery, the nurse priority is to ensure the patient has eaten, teach about post-operative exercises, confirm informed consent is signed, start IV fluids. Correct answer is option C, confirm informed consent is signed. A patient with muscle cramps and flat T-waves likely has hyperkalemia, hypokalemia, hypernatremia, hyponatremia. Correct answer is option B, hypokalemia. Which of the following best represents objective data? I feel dizzy, I am worried about my surgery, my stomach feels funny, temperature is 101 Fahrenheit. Correct answer is option D, temperature is 101 Fahrenheit. What is the most important nursing action during digital removal of feces? Wearing sterile gloves, monitor heart rate, insert deeply, avoid lubrication. Correct answer is option B, monitor heart rate. The most effective way to prevent the spread of infection is hand washing, using hand sanitizer, wearing gloves, isolating all patients. Correct answer is option A, hand washing. Which action is part of the implementation phase? Creating a care plan, gathering patient history, administering medication, evaluating progress. Correct answer is option C, administering medication. Which documentation error can lead to legal consequences? Using medical abbreviations, charting before providing care, writing in black pen, documenting at the end of the shift. Correct answer is option B, charting before providing care. Which of the following foods helps prevent constipation? Cheese, white rice, white bread, apple with peel. Correct answer is option D, apple with peel. Thanks for watching. Subscribe to the channel for the latest informative MCQs.